Good evening, I'm Esha. So I'll be presenting about gamification and engagement among obese regarding weight management. So before I proceed, I would like to share with you the definition of gamification here, which came in the extant literature in the year 2010 by Bunchball, and he described it as the use of game mechanics in non-game activities which can influence people's behavior, and primarily this was used in the field of consumer behavior research. And later, further definitions came in the year 2011, which is most popularly used these days as well. And the further refinement came in 2011 itself by Zimmerman and Cunningham, who described gamification as a process of using game thinking and game mechanics to engage audience. Now, in the context of digital health, it is nothing but a mix of gaming techniques, mechanism, principles, so as to improve the health outcomes as well. So I'll move forward. Now, what is the size of this market? Because it's quite of strategic importance here. As you can see on my slides, the market is expected to grow up to around 47,000 million USD by the year 2026. So it's huge, and it is growing at a CAGR of computed annual growth rate of 11.9% for this forecasted period. This is as per the study given by Young and Garrett in 2019. And also, if I have to tell you that, see, as I mentioned earlier also, gamification in healthcare refers to using game concept techniques, methods in the non-game applications, which can further enhance the healthcare outcomes. So it is not just confined to the education side, but also to the patient engagement, motivation, and also treatment adherence as well. Gamification has primarily three components. First, of course, the game elements like points, badges, leaderboards, avatars. Second is something called the game technique, which is about the game design per se. And third part is, of course, on the non-game context, which is related to education, health, business, something which is generic in nature. Now, I'll move on to the aim and the objective of my study, the paper that I had worked on. So it was, first of all, to determine the significance and also the effectiveness of gamification in the healthcare sector, and particularly within the, particularly for the obese and overweight people who were looking forward for their weight management, and also to recommend strategic factors that can effectively help in the improvement in consumer engagement process in healthcare. In terms of contribution of the paper, so this is the first of its kind wherein the primary research study has been done on gamification and engagement among obese patients. And also as a takeaway from this paper, it can help the game developing companies to consider the role of education, infotainment therapy while they're developing the solution to improve the healthcare consumer engagement. And also it put forth the triggers and barriers to the adoption of gamification, which can in a way be useful to the policy makers as well. And in terms of the method that I had followed for this paper, the study's sample comprised of around 9 patients, and they were all interviewed in Kolkata, India. And they were all people with elevated BMI, and they had elevated BMI for last 1 year. So all these 9 patients with a BMI of more than 30 were selected, and they were first asked whether they are aware about the gamification or are they using any apps or not. And the technique that was used for interviewing was laddering style technique. So in this laddering technique, the value ladder that I had created while interviewing them was to ask them about the familiarity, then the use and the application, and what was their motivation for using the games, and further on what are the various triggers and barriers of engagement, and finally the influence on their health outcome by using those particular apps, or let's say by using those particular portals which have games in it. Now, as a conclusion, so I had figured out clearly the first one, familiarity in terms of mobile gamification. all these participants had some level of familiarity with the apps. Like for example, I mentioned here, patient one or participant one used the Get Grow Fit app, while participant three used the Fitocracy app, while patient five used the Healthy Wage app, and they were getting monetary rewards, and they were also using elements like avatar. Also, they were also part of online games on these apps, and also the social network. So that was a level of familiarity with the mobile game apps, specifically for the weight loss programs. In terms of the factors, it came out clearly from the interview that the participants consider outcome as something which is the greatest motivator, and followed by that are the rewards and the incentives. Now, rewards and incentives have different connotations for different people, or let's say different participants. For example, participant 6 felt that he felt more and more motivated when he could see his weight losing, and participant 7 had already lost 2 kg and by setting the goals and accomplishing them, while there was also other participants who felt that, for example, participant 9, that rewards empower and motivate them to set the new goals. So that was something which was one of the factors for adoption or for the usage of mobile apps with gamification for weight loss. In terms of the effectiveness of the gamification app in health outcomes, it came very clearly that it can enhance performance and participation in therapeutic interventions, and specifically in patient engagement programs. So also this was an observation from various participants, like like one of the yeah like one of the participant had was using the Fitocracy app, and it had helped him to keep a track of the activities and motivated him to accomplish the goals. So most of the participants were attributing their health outcomes directly to the apps that they were using with the set goal, and they were able to accomplish the same. In terms of the challenges which came out from the interviews, semi-structured interviews, was, of course, they were concerned about the data privacy. A statement made by one of the participants: I had to pull all of my healthcare data in the app, and also lack of the face-to-face communication with the physician. So that was something wherein the participants felt a little dicey in initially. They were having trust issues initially, in terms of sharing their daily routine and also the diet that they are having, but that actually fizzled out in a span of, let's say, 1 or 2 months, when the patient had developed some kind of an equity with the physician present on the app. And also in terms of the novelty of the content, so most of the participants complained that to start with, game element on these apps was wonderful, interesting, and also intriguing, and it could keep them engaged, but not for very long, because the content that was going in the app was not updating regularly, and was something which could not get the interest of the participants for longer. In terms of limitations of my study, first of all, only primary qualitative data was considered. Secondly, it was a very small size of just 9 patients. And thirdly, and most importantly, I just included the obesity patients in this study, which actually narrows down the entire applicability of gamification in the field of healthcare research. In terms of future research areas, I've just mentioned 2 here, while there's a long list. First of all, definitely in terms of investigating specific elements of gamification that may enhance and hinder the effects of neurocognitive trainings on weight loss. And second and most important one is to ascertain the extent to which the gamification is able to boost health outcomes. So that is something which has to be looked out in the future research possible. And also third and most important, which I have not mentioned here, is in terms of the various game elements. So which one is more effective, and in which kind of disease are they effective? Because this study is particularly for obesity, but if we have to consider cardiovascular and other oncology, so by how much and which particular element will be effective, that can be studied as well. So thank you so much. This was all from my side.